Just have an opening comment and then I'll be ready for your questions. Je vais commencer en reconnaître ce qui s'est passé à Laval. C'est une tragédie horrible. Je n'ai pas les mots pour exprimer comment c'était horrible. Mes pensées sont avec les familles des victimes et aussi je veux reconnaître le travail des premiers respondants. I just want to take a moment to acknowledge the really horrific tragedy in Laval. I don't have the words to express how horrible it is. I just want to acknowledge the first responders and send my thoughts to the families of the victims. I want to talk today about healthcare. Of course, we saw the Prime Minister's meeting with the premiers yesterday. I want to raise a couple of major concerns. First of all, the Prime Minister in the past made it clear that he supported private or public healthcare, and it's hard to keep them in track because now he's done a major flip-flop and called private for-profit care innovative. And when asked the question, Premier Ford confirmed that he did not bring up the question of private for-profit care at all in the discussions yesterday. So we're deeply concerned about that. We imagine a healthcare system that's there for people when they need it. And what we've said from the beginning is that we would judge this deal based on whether or not it hires more healthcare workers and responds to the healthcare shortage and make sure that people get the care they need. As Prime Minister, what I would do when I'm Prime Minister is make sure we meet with premiers and discuss how we can rebuild our healthcare system so it's there for people when they need it, so that everyone has a family doctor. People can access a family doctor. That seniors aren't waiting for months and months in pain while they wait to get their hip replaced. That people don't go into a hospital with their child and wait overnight, all day to get care in an emergency room. So we imagine a healthcare system that's there for people when they need it. And it's no surprise that the leader of the Conservative Party is applauding this agreement because it does open the door for more for-profit private care. It doesn't impose any conditions. The Prime Minister made a big deal of having strings attached or conditions. There's no meaningful conditions or strings attached in this offer. It doesn't in any way meaningfully require the provinces to do something to respond directly to the problem of hiring more healthcare workers or nurses or doctors or deal with the crisis that we're up against. And so those are our concerns. Donc, avec l'entente ou l'offre du Premier ministre, premièrement, dans le passé, le Premier ministre a dénoncé la privatisation à but lucratif et maintenant, il a fait une volte-face majeure parce qu'il appelle la privatisation comme l'innovation. Donc, c'est une volte-face. Aussi, c'est confirmé qu'il n'a pas soulevé la question de privatisation hier. En plus, il a parlé beaucoup des conditions. Des conditions, mais dans cette offre, il n'y a aucune condition concrète pour régler la crise dans notre système de santé. Ça veut dire en condition de ne pas utiliser l'argent public pour les services privés à but lucratif. Aucune condition pour s'assurer qu'on embauche plus de travailleurs de santé, ce qui est vraiment la crise. Donc, ça, c'est une autre inquiétude. Et finalement, le chef du Parti conservateur applaudit cette entente ou cette offre parce que ça ouvre la porte pour la privatisation à but lucratif. Donc, les conservateurs et les libéraux sont sur la même page par rapport à la privatisation et c'est pourquoi ils sont d'accord avec cette entente.
Est-ce que vous allez revenir le budget si jamais l'entente reste la même en ce moment?
On n'a pas vu les détails du budget, donc on n'est pas prêt de dire si on va voter oui ou non. On doit voir le budget avant de faire cette décision. Ce n'est pas une décision qu'on va prendre aujourd'hui. On va voir le budget et puis décider.
Show some courage. If you really don't like what you see or hear, you do have that option of voting against it in the upcoming budget. Is that an option at the back of your head? Are you thinking of that?
We always have the option of withdrawing our support. That is always an option that we can exercise, but we're not going to decide on whether we're supporting a budget or not before seeing it.
Non, mais la question, c'est pas sur le budget, mais sur cette entente. Cette entente, on la voit, on nous dit bien qu'elle est finale. Vous, est-ce que cette entente que vous dénoncez est de nature à vous amener à enlever votre appui au gouvernement?
Ce n'est pas une décision qu'on va prendre aujourd'hui. On dénonce le fait que cette offre ne répond pas à la crise dans notre système de santé. Oui, le gouvernement a augmenté le financement. C'est quelque chose qu'on a demandé que le gouvernement fait. Donc ça, c'est quelque chose de positif. Ça va aider. Mais le Premier ministre lui-même a dit souvent, il a parlé souvent des conditions. Mais où sont les conditions? Il n'y a aucune condition pour vrai, aucune condition concrète dans cette offre. Et je parle des conditions comme on doit utiliser notre argent public pour les services publics. Je parle des conditions comme on doit essayer les provinces à embaucher plus de travailleurs de santé. Ce sont des conditions qui vont régler le problème dans notre système maintenant, la crise dans notre système, et il n'y a aucune étape pour régler la crise.
What would it take for you to withdraw your support in relation to this deal or final deal?
Well, the decision around when we're going to withdraw our support or not is not a decision we're making today. What we're focused on today is outlining the problems with what the government's doing, pointing out that they've not taken the Prime Minister has not opposed for-profit private care, that he has not taken a stance and not even raised that question yesterday. It was not something that even came up. Even though 2 years ago, he campaigned very firmly against for-profit care, said that watch out for the Conservative leader because he wants to bring in for-profit care, and that's not innovation. Now he's calling that innovation, so he's flip-flopped. And I want Canadians to know that we are the only party that's defending public care. That's the only party that's saying that we want every single cent of our public money going towards care, not towards the profits of rich CEOs or wealthy corporations. We want it to go to caring for our loved ones.
Why did you change up your public safety?
À part les conditions, est-ce que c'est assez d'argent qui a été donné aux provinces? Parce que c'est à peu près 6 fois moins que ce à quoi
Ils ont demandé. Donc, on va juger cette entente sur la question de si cette entente ou si cette offre règle la crise dans notre système. Ça, c'est vraiment comment on va juger ça. Ça veut dire, est-ce que les familles peuvent avoir accès à une médecin de famille? Est-ce qu'on va réduire les listes d'attente pour les opérations? Est-ce qu'on va réduire le temps d'attente dans les centres d'urgence? Donc ça, c'est comment on va juger cette entente. I'm just going to say that in English as well. The way we're going to judge this agreement, of course, there's an increase in amount of funding, but the way we're going to judge this agreement is on concrete things. Can families get a family doctor? Can people find a family doctor or not? Can seniors who are waiting for months and months in pain get access to the surgeries they need quicker? Will the time or the delays in emergency rooms be reduced? That's what we're looking for, concrete fixes to the healthcare system, and that's how we're going to judge this offer or this agreement.
Why did you change
Dollar
your-
amounts are concrete things as well. Is it high enough, or what would you have done?
Well, what I would do, if the question is what I would do as Prime Minister, as Prime Minister, my vision, what I will do as Prime Minister is meet with premiers to talk about how do we rebuild a healthcare system that actually works? How do we make sure people get a family doctor? How do we make sure that emergency times aren't through just incredibly long? How do we make sure that people can get the surgeries they need without having to wait for months and months in pain? Like, these are the concrete things I want to fix. I want to hire more healthcare workers, more nurses, more doctors. We want to make sure that we're fixing and rebuilding our public healthcare system. That's what I would do.
Don't you think that's what they did? Pensez-vous pas que c'est ça qui est arrivé? Meeting with the PM, see how to rebuild the system. Isn't not what they did?
Non, pas de tout ce qu'ils ont fait. Ce que le Premier ministre a fait, c'est une rencontre. On a demandé que le Premier ministre rencontre les premiers ministres des provinces. Pour des mois, on a dit qu'il doit rencontrer les premiers ministres parce qu'on est dans une crise de santé, donc il n'a pas fait ça. Et on a dit qu'on doit avoir des garanties qu'on augmente les nombres des personnels des personnels de santé, des travailleurs de santé. Aucune condition, aucun plan pour régler la pénurie des travailleurs de santé. Donc ça, c'est le problème et aucun geste majeur pour répondre à ce problème.
Private clinics.
Very clearly that you would consider this deal to be a failure if you could meaningfully address privatization, staffing. You don't seem happy in those scores. Are you calling it a failure now, or are you walking it back?
So right now, as it stands, there's no guarantee in terms of staffing levels or path to increasing healthcare workers. That, to me, I've always said would be the major test. And so far, the government has failed on that point. There is no clear path here. There's no clear plan to hire more healthcare workers. And that means it is a failure. There's no clear plan here to address the shortage of family doctors. And there's no plan in what the government has proposed, what the Prime Minister has proposed, that to a family right now, they can't find a family doctor. does anything to make that easier. There's nothing in this agreement or in this offer that reduces wait times in hospitals and emergency rooms for surgeries, and that to me is how we're going to judge this deal. And so far, it is a failure on those grounds.
Thanks very much, everyone.
Sorry, we got
Okay, thanks so much. Merci. Thank you. Merci.